This video is part of a series of commonly asked questions regarding Ehlers-Danlos Syndrome. I have seen these questions come up various times in Facebook and support groups, with various answers, many of which were coming from personal experiences. I wanted to create a spot where these questions were researched so patients could understand the entire risk or reward from undergoing a certain treatment or lifestyle change. This video is going to touch on the risks of tattoos when you have EDS. We are going to talk about suggestions, contraindications, potential complications, recovery, and references for further information. General suggestions for tattoos include: make sure it is a tattoo you want. Removal is painful, expensive, and does not always work. Go to a reputable, clean shop. Scarification tattoos may cause more issues with EDS. It takes around 3 months for full healing. Sun exposure may prolong healing of tattoos. Certain colors such as red are more painful to be tattooed and are more likely to cause reactions. A major disclaimer for this video is that there are no studies evaluating EDS and tattoos, so these risks are extrapolated from existing research. It is important to talk to your medical team and tattoo artist regarding your concerns. Contraindications to tattoos include skin infections, chronic skin disorders, pigmented skin lesions, congenital heart disease, blood clotting disorders, pregnancy and breastfeeding, and immunosuppressive diseases and treatments. Some potential complications of tattoos include skin infections, allergic reactions, photosensitivity, and dissatisfaction of the aesthetic. Some major concerns with EDS and tattoos include the aspect of skin fragility, which may put you at a higher risk of tearing or bruising from tattoos. Skin scarring from tattoos is a rarer side effect from tattoos. You may cause a granuloma, which is an inflammatory scar. Keloids may also happen, which are raised areas from scar tissue overgrowth which occur following tattoo burns and tattoo scarification. There are also substantial risks when tattooing on scars, as you may develop the same lesion at the tattoo site. Some guidelines are that you should not tattoo on a pigmented lesion, previously cancerous scars, burn scars, increases cancer risk of squamous cell carcinoma, or surgery scars. Although, you can tattoo on stretch marks for camouflage, but case-by-case evaluation is recommended. Concerns with stretchy skin is that the tattoo might not sit properly on skin. The tattoo artist may need to stretch skin during the tattoo, which may lead to some distortion of the tattoo. There are of course concerns with skin infections, as tattooing should take place on clean, stabilized, and healthy skin. The skin is the barrier against chemicals and microorganisms. Any active skin infection or inflammatory lesions such as eczema, dermatitis, and acne should be treated first. There are concerns regarding heart conditions due to the risk of infective endocarditis in those with congenital heart disease. This infection is associated with Rustemeyer, potential dissemination, and multiple septic emboli. With tattooing, it is associated with Staphylococcus species, which occurs during tattooing because of a lack of hygiene, a mistake with disinfection, use of contaminated material, or possibly during the healing phase because of a lack of hygiene or proper aftercare. Unusual symptoms occurring within weeks after tattooing, fever, chills, malaise, night sweats, or dyspnea should prompt examination for a heart murmur or infective endocarditis, even if the tattoo is asymptomatic. An asymptomatic tattoo, devoid of any local sign of infection, should not rule out the diagnosis of IE. Before getting a tattoo, those with a cardiac murmur or congenital heart disease should speak to a doctor and discuss prophylactic antibiotics. Antithrombotic treatment should not be used while tattooed because of bleeding risk. The tattooist should be aware of the heart condition and use the maximum asepsis, such as using new ink bottles. Blood disorders such as hemophilia, thrombopenia, and von Willebrand disease come with a risk of transient bleeding or extensive ecchymosis. Extensive ecchymosis under the tattoo is rare but possible and can raise concern for the customer. There are risks of tattooing while taking anticoagulation meds like heparin, antivitamin K, or aspirin. Blood disorders and antithrombotic medication can be associated with an increased risk of bleeding but rarely cause major problems in tattoos. The risk of bleeding is much higher with body piercings. The antithrombotic medication can lead to excessive and protracted bleeding. Temporary withdrawal of the medication can be discussed with the treating physician. The reason why this medication is administered should also be taken into consideration. In small tattoos and line tattoos, bleeding can be controlled more easily by compression. If you have a blood disorder, before being tattooed you should speak to a doctor about prophylactic antibiotics and stopping anticoagulation treatment. You should speak to the tattooist about using maximum asepsis and choosing an area with thicker skin to reduce bleeding. Immunosuppression puts patients at a risk of infection with tattoo. Infections mainly occur due to a lack of sanitation, immunodeficiency or immunosuppression, oral corticosteroids, methotrexate, and TNF-alpha blockers. Potential complications: increased fatigue, diminished post-tattoo stamina, a delay in healing, and cutaneous infection. The level of immunosuppression related to the therapies, the disease itself, and the potential comorbidities, such as diabetes, must be taken into account prior to tattooing. The reasons for contraindications should be explained to the patient, stressing that they are temporary and related to the risk of severe infections. It remains reasonable to delay or avoid any tattoo when the disease is active and the treatments are currently at high dosages. Systematically advising patients against a tattoo under mild immunosuppressive treatment is not supported by experience or data in the literature. Lastly, patients may develop other complications on tattoos if the immunosuppressive treatment is given again for a skin condition like psoriasis, sarcoidosis, or chronic cutaneous lupus. Before getting tattooed, speak to a doctor about prophylactic antibiotics and stop anticoagulation treatment. Speak to tattooist about using maximum asepsis and choosing an area with thicker skin to reduce bleeding. Most tattoo artists will not tattoo someone who is pregnant or breastfeeding. Although, to date, no complication regarding the infant has been reported after a mother has undergone tattooing during pregnancy or breastfeeding. For the fetus, the risks of transmission of infection, bacteria, and toxic chemicals through the placenta and the milk have never been evaluated. Moreover, maternal bacterial infections are rarely transmitted to their infants through breast milk. Of most importance, some of the chemicals found in tattoo inks like heavy metals and amines can be transferred through the human placenta. MRI complications may occur from tattoos such as tattoos or permanent makeup causing swelling or burning in the affected areas during MRI exams. In some cases, tattoo pigments can interfere with the quality of the image. One major concern with those with EDS and mast cell activation is the risk of allergic reaction to tattoo ink. Tattoo dyes can cause allergic skin reactions months or years following a tattoo. This is especially common with red, green, yellow, and blue dyes. Reactions may occur following sun exposure or with each new tattoo. It is a rare reaction and difficult to prevent. Systematic preventive allergy testing like patch tests of the colorants and the inks has no predictive value. It is useless, expensive, and time-consuming. Dermographism and urticaria are some major allergic concerns with tattoos. Tattooing will induce an inflammatory edematous reaction in every person as soon as the needles start to puncture the skin. Active dermographism may superimpose over the local acute reaction and cause severe itching and discomfort. Oral antihistamine intake before the tattoo session can be helpful. Before getting tattooed, if one has severe allergies, it is worth discussing the desire for a tattoo with a doctor about getting an EpiPen, and for allergy testing if indicated. Speak to your tattooist about allergens like latex, preservatives, scents, rubber, or the like. Some of these complications may be partly attributed to the mechanical aspect of tattooing, as repetitively inserting a needle into the skin causes microtrauma, which in itself may cause inflammation and create ports of entry for potential pathogens. However, other complications are caused by the injected tattoo ink itself, for example, allergic contact dermatitis, ACD, to tattoo pigment. ACD is a type for delayed hypersensitivity reaction of the skin, which is characterized by symptoms such as swelling, redness, pain, ulceration, skin necrosis, and hives. Symptom severity ranges from mild to intense, potentially causing considerable chronic discomfort for the patient, resulting in decreased quality of life. Research has shown that tattoo inks can induce ACD, with disease onset varying from within 1 month after tattoo application to several years later. Allergic reactions are predominantly found in tattoos containing red ink, which is related to higher rates of inorganic impurities such as nickel, cadmium, mercury, and organic pigments such as azopigments due to their vivid color and longevity. According to a study on reconstructed human skin, tattoo inks exhibit localized cytotoxicity, influence metabolic activity, and result in inflammatory cytokine release. Now to discuss tattoo recovery. It is important to cover it up with antibiotic ointment and plastic wrap or bandage. Gently wash the tattoo after removing the cover with warm water, fragrance-free soap, and pat it dry. And finally, moisturize the tattoo with alcohol-free and fragrance-free moisturizer. While waiting to heal, ensure you have ample sun protection via clothing and watch for symptoms of infection. Don't use sunscreen, scratch or pick at the tattoo, nor wear tight clothing over the tattoo. Finally, do not go swimming or bath, have showers only. The recovery process includes a few phases. First, redness and oozing for 1 to 2 days. Scabbing and excess ink drain off for 2 to 3 days. The redness fades and scabbing continues after 4 to 6 days. Scabs flake off and itch for 6 to 14 days, and the tattoo should no longer be red and swollen. Research suggests to keep moisturizing for around 30 days minimum. Some great products to use for recovery include unscented Castile soap and moisturizers such as coconut oil, Aquaphor, and Eucerin. Thank you for watching, and stay tuned for future videos exploring commonly asked EDS questions. Feel free to hit the subscribe and like button to see more content.